stretch your hands up and come first to Namaskar Mudra. Stretch your arms up, gently arch back. As you exhale, we're going to reach forward and down. And if you need to, bend your knees to get your palms down onto the mat. If you can't get your palms down on the floor, maybe you have just your fingertips down on the floor. Now we move to Ashwa Sanchalan, the equestrian pose. Step your right leg back as much as you can and rest the right knee down on the floor. Stretch the toes out behind you. Press the fingertips or the palms down and look up. Gently press the palms down, curl the right toe under, pick up the right knee. Your body is in a nice straight line. You're going to move into that plank or push-up like position by sliding the left leg back. Now gently bring the knees down. Bring your chest down between your hands, keeping the hips up and the elbows tucked into the body, and rest your chin down on the mat. Inhale and gently slide forward. Elbows are tucked in. Bend. You're going to try and look up if you can. Stretch your toes out on the mat behind you. Press the palms down into the floor. And going straight up into the inverted V. Coming back to the equestrian pose from this inverted V. Just swing your leg forward between your hands and then gently place your left knee down onto the mat. Look up. You can try and have your palms down if they allow you. Gently curl your left toes under. Pick up the left knee. Take a giant step forward with your left leg. Now you can either have your knees bent here, fingertips just touching the floor, or if your legs allow you, you can straighten up the legs and press the palms down. Gently draw the head into the knees. From here, we're going to reach forward, trying to come to a tabletop position, reaching to the other end of the room, gently coming up, arching back softly and bringing the arms down.
Now, let us move to Yogasana. Tadasana. Tad means palm tree. Keep your feet 2 inches apart. Interlock the fingers and turn the wrist outwards. Inhale. Raise the arms up and bring them in line with the shoulders. Raise the heels off the floor and balance on the toes. Stay in this position for 10 to 15 seconds. This asana brings stability in the body, helps to clear up congestion of the spinal nerves, corrects faulty posture. Exhale, bring the heels down. Release the interlock of the fingers and bring the arms down parallel to the trunk and come back to a standing posture. Padhastasana. Pada means foot, hasta means hand. Inhale slowly and raise the arms up. Stretch up the body from the waist. Exhale and bend forward until the entire palm rests on the ground. Maintain this final posture for 10 to 30 seconds. Those who have a stiff back should bend according to their capacity. Now, inhale. Come up slowly to the vertical position and stretch the arms above the head. Exhale and slowly return to the starting position in reverse order. Relax. Ardha Chakrasana. Support the back at the waist. Exhale. Drop the head backwards, stretch the neck muscles, and bend backwards from the lumbar region. Relax with normal breathing. Stay there for 10 to 30 seconds. Ardha Chakra makes the spine flexible and strengthens the spinal nerves and improves breathing capacity. Inhale and slowly come up and relax. Hypertensive patients shall bend with care. Trikonasana. Trikon means triangle. Stand with your feet comfortably apart. Slowly raise both the arms sideways till they are horizontal. Exhale. Slowly bend to the right side and place the right hand just behind the right foot. The left arm is straight up, in line with the right arm. Remain in this posture for 10 to 30 seconds with normal breathing. This prevents flat foot, strengthens the calf, thigh and waist muscles, makes the spine flexible. As you inhale, slowly come up. Repeat for the left side. Avoid this posture in case of slipped disc, sciatica, and after undergoing abdominal surgery. Do not go beyond your limits. Bhadrasana. Let us now get ready for sitting postures. Bhadrasana. Bhadra means firm. Sit erect with the legs stretched out straight in front. Keep the hands beside the hips. This is Dandasana. Now put the soles of your feet together. Exhale and clasp your hands together over your toes. Pull your heels as close as possible up to the perineum region. This is the final position. Stay here for some time. Bhadrasana keeps the body firm and stabilizes the mind. Now stretch your leg and come to Vishramasana. Avoid this practice in case of severe arthritis and sciatica. Vajrasana. Sit in Dandasana. Fold your legs and sit on your heels. Keep the thighs close and big toes touching. Place the hands on the knees. The head and back should be straight. This is Vajrasana. Ardha Ushtrasana. Sit in Vajrasana. Get up on your knees. Place the hands on the waist with the fingers pointing downwards. Keep the elbows and shoulders parallel. Bend the head back and stretch the neck muscles. And bend the trunk backwards as much as possible. As you exhale, relax. Remain in this posture for 10 to 30 seconds with normal breathing. It helps to strengthen the back and neck muscles, relieves constipation and back pain. Return with inhalation. Sit in Vajrasana. Relax. Shashankasana. Shashank means hare. Spread both the knees wide apart. Keep the toes touching. Keep the palms between the knees. Exhale and slowly stretch them full length. Bend forward and place the chin on the ground. Keep the arms parallel. Look in front and maintain the posture. This helps to reduce stress and anger. Inhale and come up. Exhale and come back to Vajrasana. Stretch your legs back to Vishramasana. Patients with osteoarthritis should do this with caution. Uttan Manduk Asana. The final position of Uttan Manduk Asana resembles an upright frog, hence the name. Sit in Vajra Asana. Spread both the knees wide apart while the toes remain together. Inhale. Raise both the arms. Then cross both arms behind the head and place the hands on the upper part of the opposite shoulders. Keep the back and neck straight. Maintain this position for a while. This asana is helpful in backache and cervical pain. It helps in improving diaphragmatic movement and helps to improve lung capacity. Persons with severe knee joint pain should not perform it. While coming back, slowly raise both the arms with inhalation. Bring back and bring the knees together as in the initial position. Makarasana. Makara means crocodile. Lie down on your stomach with the feet wide apart, feet pointing outward. Rest your head on your hands. Relax. This is Makarasana. This asana is practiced for relaxation in all prone postures. It promotes relaxation of the lower back. Bhujangasana. Now let us be ready for prone postures. Bhujangasana. Bhujang means snake or cobra. Lie down on your stomach, rest your head on your hands and relax the body. Now join your legs and stretch your arms. Keep the forehead on the ground. Keep your palms beside the chest and raise the elbows. Inhale, lift the chin and chest up to the navel region. This is Bhujangasana. This asana is best for stress management. It also helps to manage backache and bronchial problems. Exhale. Rest your forehead on the ground and stretch your arms. Spread your legs. Place your palms and rest your head on the palms and relax. Uttan Padasana, raised feet posture. In this asana, the legs are raised upward in a supine position, hence the name. Lie comfortably on the ground with the legs stretched out. The hands should be placed by the sides. While inhaling, slowly raise both the legs without bending them at the knees and bring them to a 30-degree angle. Maintain this position with normal breathing. Exhale and slowly bring both the legs down and place them on the ground. It balances the navel center, Nabhi Manipura Chakra. Ardh Halasana, half plow posture. This posture is known as Ardh Halasana because in its final position, the body resembles half the shape of an Indian plow. Take a supine position. Keep the hands by the sides of the thighs, palms resting on the ground. Slowly raise your legs together without bending at the knees. First raise the legs up to 30 degrees, then further up to a 60-degree angle. Now, slowly raise the legs to a 90-degree angle. This is the final position of the Ardh Halasana. The body from the hip to the shoulder should be kept straight. Then slowly bring the legs back to the ground without lifting the head. This is very beneficial for hypertensive patients, but needs to be practiced with care. Those who have lumbosacral or lower back pain should not perform this with both legs together. Pavan Muktasana. Bend both the knees and bring the thighs to the chest. Interlock the fingers and clasp the shin below the knee. Raise the head and shoulders. Try to touch the knees with the chin. This is Pavan Muktasana. This removes constipation, gives relief from flatulence, and tones up the back muscles and spinal nerves. Bring your head back. Exhale. Stretch your legs and relax. Avoid this practice in case of abdominal injuries, hernia, sciatica, and during pregnancy. Shavasana. Shav means the dead body. This asana is meant for complete relaxation. Lie down on your back with the arms and legs comfortably apart. Palms facing upward, eyes closed. Relax the whole body consciously. Become aware of natural breath and allow it to become rhythmic and slow. Remain in this position till you feel refreshed and relaxed. This asana helps relieve all kinds of tensions and gives rest to both the body and the mind. It is very beneficial in the management of stress and its consequences. Kapalabhati. And stimulates respiratory centers in the frontal brain. Sit in any meditative posture. Close the eyes and relax the whole body. Inhale deeply. Expand the chest. Expel the breath with forceful contractions of the abdominal muscles. Continue active exhalation and passive inhalation. Then, take a deep breath, exhale slowly, and relax. This is one round of Kapalabhati. Each round should be followed by deep breathing. Now, do 2 more rounds. Kapalabhati purifies the frontal air sinuses, helps to overcome cough disorders. It is useful in treating colds, rhinitis, sinusitis, asthma, and bronchial infections. Please avoid this practice in case of cardiac conditions, high blood pressure, vertigo, migraine, stroke, hernia, and gastric ulcers. Pranayama, Nadi Shodhana, or Anulom Vilom Pranayama. is alternate breathing through the left and right nostrils. Sit in a meditative posture. Keep the spine straight and the head erect with eyes closed. Relax the body with a few deep breaths. Keep the left palm on the left knee in Jnana Mudra. The right hand should be in the Nasikagra Mudra. Place the right thumb on the right nostril. Breathe in from the left nostril. Close the left nostril. Exhale through the right nostril. Next, inhale through the right nostril. Close the right nostril and exhale through the left nostril. This is one round of Nadi Shodhana or Anulom Vilom Pranayam. Repeat for another 5 rounds. For beginners, the duration of inhalation and exhalation should be equal. Gradually make it 1:2. Inhalation, exhalation. The breath should be slow, steady and controlled. The main purpose of this pranayama is to purify the principal channels of energy. This nourishes the whole body. It induces tranquility, helps to improve concentration. It increases vitality and lowers the level of stress and anxiety. It also elevates cough disorders. Shitali Pranayam. Sheath means cool. It also means calm and passionless. As the name indicates, this pranayam cools the mind-body system. Sit in the Padmasana or any other comfortable sitting posture. Place the hands on the knees in the Jnana Mudra or Anjali Mudra. Roll the tongue in from the sides to shape it as a tube. Inhale through this tube-shaped tongue. Fill the lungs with air to their maximum capacity and close the mouth. And then slowly exhale through the nostrils. Shitali Pranayam purifies the blood. It has a cooling effect on the body. It is beneficial for persons suffering from high blood pressure. It satisfies thirst and appeases hunger. It relieves indigestion and disorders caused by phlegm, cough, and bile. It is beneficial for the skin and the eyes. Those who are suffering from cold, cough, or tonsillitis should not do this pranayama. Bhramari Pranayama. Bhramara means a black bee. During the exhalation of this pranayama, the sound produced resembles the buzzing of a black bee. Inhale deeply through both nostrils. Exhale slowly in a controlled manner, making a deep, steady, humming sound as that of a black bee. This is one round of Bhramari. Repeat 2 more times. This is a great tranquilizer. It's found good in the management of stress-related disorders. Now do the Bhramari with Shanmukhi Mudra. Close your ears with your thumbs. Place the forefingers on your eyes, middle fingers on the nostrils, ring finger and small fingers on the lips. Open your nose and inhale through both nostrils. Exhale slowly in a controlled manner, making the deep humming sound of a black bee. It is a useful preparatory pranayama for concentration and meditation. Dhyan. Now, let us prepare for Dhyan. Dhyan or meditation is an act of continuous contemplation. Sit in any meditative posture.